Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. There's been a lot of questions about telemedicine. How does telemedicine work? Is it effective? Et cetera, et cetera. Well, I figured the best way to find out is to bring one of the initial experts in the delivery of telemedicine not only in the state of Florida, but in the United States. And let me introduce to you Dr. Deborah Mulligan, who is an assistant professor of pediatrics at the Kiran C. Patel College of Osteopathic Medicine. Welcome, doctor. How are you?
Thank you. I'm really delighted to be with you again on the show. Thank you for inviting me.
Okay, let me give a couple of little notes so that you realize that Dr. Mulligan has been very, very proactive in the protection of children, children's rights. She worked with probably one of the most influential people in the entire state of Florida. You were the first woman to be the chairperson of the Florida Pediatric Association.
Thank you. Thank you. Yeah, so I moved here from San Francisco and didn't know the state of Florida. And to your point, the first person I was told by the dean of UCLA, you need to find Dr. Jerry Schiebler. That's what my dean told me from the medical school. So I call him up, and you'll know this is such his style. I call him up and introduce myself, that I was referred from the dean of UCLA. He said I had to find you, and Dr. Jim Siddell. And Dr. Schiebler said, do you belong to the FMA? Do you belong to the Florida chapter of the A.P.? No, sir, I don't. And he said, when you join and pay your dues, talk to me. And he hung up on me. So I immediately paid my dues, called him back. And to your point, over the years, I became the first female president of the Florida chapter of the A.P. since its discovery in 1932.
So let's get on to the subject matter, which is telemedicine. And we talk about utilizing telemedicine for children and childhood vaccines. So it's all yours, Dr. Mulligan.
Okay. So, what is that proverb? They say necessity is the mother of invention. So, with COVID on the rise, telehealth catapulted into the scene. If we look at that bell-shaped curve about innovation and early adoption, you and I are trailblazers. We're always going to see early on where there's a need and a potential solution to help our community. And so you and I have been part of that world for over 10 years, but that wasn't everyone. It was a slow kind of chugga until the pandemic. For an example, the CMS, Center for Medicaid and Medicare, reported recently that before the pandemic, only maybe 14,000 patients a week were using telehealth. Now it's 10 million of their beneficiaries. And so that's almost a 200,000 increase. Of course, the providers are supporting that because they want to be able to continue to provide coordinated, high quality care through the medical home to their patients during this pandemic when we were, quarantined for a very long time. And so providers now report that they were only using it maybe 9% of the time before the pandemic. Now it's over half. And so we are well on our way into recognizing that the necessity of telehealth as a tool toward remote care, digital care, is critical to provide healthcare delivery systems. And it's a new way to a new vision for remote monitoring, operations, clinical care, and payment has changed, which of course encourages people to use it more because they're able to function as they would in their office for people in a spectrum, right? Urgent care, they're not going to retail clinics anymore. They're staying with their doctors through telehealth. So that continues to understand what their healthcare needs are. Or children that are transitioning from 18 to adulthood, there are also pathways to manage that kind of care for transitioning. Or mental health. It's a 40% of the population in our country needs mental health services. How do you get access? You don't unless you start using telemedicine. So it's just a beautiful opportunity for people to learn more about it and take advantage of that tool within our spectrum of clinical care.
You know, we have had, before this insidious pandemic, there was some focus, but really only at the organized medical level, of the nature of the inability to service certain areas of various states. You could look right here in the state of Florida. We have underserved areas. If you have problems, the greatest, you just mentioned the amount of people that are now using telehealth, but even more importantly in my mind, and maybe your mind, is the availability of health care. It's not the context of talking to someone who might give you an opinion, but it's talking to someone who will keep you healthy and will cure your illness.
That's exactly it. That's exactly it. And there's so many use cases. Think of the person with Parkinson's. How hard is it for them, whether they're in an urban underserved area or a rural community? Imagine how much time and effort it takes to be able to get to the doctor for just a follow-up appointment, just to adjust your medicine. Now you can use telehealth, and your neurologist can do an exam via video. They can adjust your medication based on that follow-up visit, and then you come into the office when you need more in-depth evaluation. There's just so many wonderful use cases. And so, Dr. Lippman, I know that you were behind the effort to advocate that we start creating a training program for our medical students. And I'm so proud of them. We are now the 5th largest medical school in the country, NSUKPCOM, 5th largest. And we provided, there's only a handful of universities, medical schools in the country that provide training in telehealth to medical students. Oh, sure, everybody's doing it with residents, attendings, providers, but not the medical student who's your boots on the ground, right? And so we trained over 420 students. That's something to listen to. And so we just, with one of the medical students, presented at a national summit called SEARCH, which is a research summit on telehealth. And we were just overwhelmed by the interest and the positive reaction from all the big universities that were in attendance, because they want to know, what is NSU up to and how did you pull that off? More importantly, the students are giving us feedback now, the 4th years who are now interns, that it was invaluable, and they're so grateful.
We were looking to the future, and the future relates to telehealth is just not communicating by visage and talking, it's through technology. So you can now wear something on your wrist. You could do an EKG. You see all these advertisements on television, which are real. That's real technology. But if you take the technology and you match it up and marriage it as part of the telehealth presentation, you've got a real doctor's office visit. Is that correct?
Yeah, it's beautiful. And again, the silver lining to the pandemic is just about everybody has a pulse oximeter, a blood pressure cuff, scale, thermometer in their homes now, because people understand how to monitor their health, especially if they fall ill from the virus. So yeah, the public is prepared as well, which makes it so much more exciting to be able to help them in a way that that is in their best interest, especially when they're feeling terrible in their home. Plus, it's like the old house call, right? It's a doctor visit in the house. You can see how they live. You can see their environment, the family, and get a better understanding of their home life when you visit, which is pretty great.
Well, you mentioned before, you're obviously from the San Francisco Bay Area. You go across. I know where you lived, and et cetera, et cetera. I know of your father's business. I was in there a number. I was in there a number of times. I got it. But it's no different if you look at where I was born. all right? Because I was a center of mankind. I was born in Brooklyn, New York. So, but when you realize that the doctor used to come to the house. You see the black Buick drive up, and there he was, you know, took out stethoscope, did whatever he had to do and everything. But really, telehealth is exactly what you just said. It's the doctor coming to your home, correct?
Yeah, it's great.
And particularly with children, and I want to focus in particularly on telehealth with children and childhood issues. So let's talk about the children. Also, childhood vaccines, which have been always part of. I think of the United States. I think there are only 3 or 4 states that don't have requirements to have childhood vaccines. So let's talk about that for a minute.
I think that plays a role. But so you're right. Since the beginning of time, disease has shaped our world, right? There was polio and smallpox where it just blazed through communities and destroyed them, devastating entire cultures. So from our point of view, today in the modern world, the most frustrating, I would say, experience for we doctors is seeing a young person or a child who has a preventable suffering or disease when the resources are available, whether that's starvation in a wealthy country, or whether that's a diagnosis of cancer and they can't get the resources they need, or a child who dies from influenza when they could have had the vaccine. So understandably, I get it that people have been afraid to leave their homes and go into offices during the pandemic for fear of exposing their children to the virus. I understand the messages were out there: quarantine, mask up, stay away. But it won't, what may not surprise our listeners, I know you get it, but gee, the World Health Organization just came out the other day and said that 23 million children did not get their basic childhood vaccine. And when we look at Florida, believe it or not, and by the way, that's the highest it's been, that number, since 2009 of children not getting their first vaccine. In Florida, I looked the other day, and our vaccination rate for children from 24 to 35 months who typically get their vaccination in the county health departments was down to 80% of those kids, where the year before it was 94%. And that's really serious because that puts our kids at risk for measles, polio, hepatitis, varicella. The risk of measles outbreak is really high when you think about 22 million infants worldwide didn't get their first dose of vaccine. And, I'm not sure if you're aware, but the fact of the matter is measles is highly contagious, far more than Ebola, influenza, or even COVID. And so we saw that outbreak in 2019, which was a measles outbreak in Europe and some pockets of the US, higher than the past quarter century. There were more cases. And I took care of kids in California who suffered from measles with pneumonia, encephalitis, infection of the brain. So, vaccinations are critically important. We need to get the kids back on track. Right now, to your point, the CDC recommends 16 disease vaccinations. And of the 16, 50 states plus DC mandate at least 7 of them. And we have a couple more extra in the state of Florida that are mandated, but it's basically diphtheria, tetanus, whooping cough, polio, rubella, measles, and chickenpox. All of them have been around for 50 years, except for chickenpox, which came out in 1995. But there is the politics of it too now. The barriers to vaccination are not only being worried about getting the COVID virus or infecting your children with other illnesses going to the office, but the messaging to the public has been so mixed and confusing from government. It's led to distrust of public health leaders and claims.
It really relates to the attitude that people are perhaps being brought to not do vaccines, when the bottom line is we've been doing it for, half a century for many items, and up till just recent years, adding other things. And I want to get on to telemedicine for other issues, but I'm almost shocked to know the statistics that you just brought forth. And I think it's very important because the wonderful young people that have migrated to the state of Florida, particularly South Florida, and we have such wonderful hospital venues that have everything to protect that child from, from the term to the time that they go home. Part of that, taking care of that child, is getting them inoculated over the next few months. Am I on target?
Right. Oh, yes. And we have thanks to you and your colleagues during your term as a legislator, the Florida Shots program is one of the best in the country. And working with kids in the NSU clinic, we do have a lot of families coming in from other places like Louisiana, New York, California, and we have to update the Florida Shots record, which then lets us know which ones that they're behind on and help them catch up. Part of the issue is because we did stamp out polio and measles in this country until such time that, like with the Brooklyn outbreak, from people coming in from Europe or the Middle East and bringing the illness because of the epidemic that was going on there, parents of young children never saw it. They never saw polio or measles. And so they don't understand the huge risk that these diseases can play in impacting the long-term life, quality of life, disabilities for their kids. So that is part of the issue. We're so successful, maybe we're too successful.
Well, you never can be too successful. You can just be successful. So let's get back to telemedicine. How broad a brush has the availability of telemedicine? I know it's functioning very well in the state of Florida, as I understand, but I'm just wondering generally, has telemedicine, as the interest from your colleagues from around the country as to what we're doing here at NSU in teaching our future health providers with the they know.
Oh yes. I think it's fine to say that places like the University of Colorado, Cornell, Harvard, we've been on group sessions with them in committees and helping to actually prepare and review and contribute toward the ACGME requirements for training medical students and residents, and the way by which they manage benchmarks to be sure that you're teaching them the right elements that should be in there. The American Board of Pediatrics now has questions that are telehealth related as we take our board exam and get recertified, or even if you're just getting board certified for the first time. There are places like the University of Colorado, and again, an example, where they reached out to me and asked, how did you do this? Because it's a big lift. It's a lot of work to be able to prepare 30 hours of training with 10 different modules that covers A to Z on risk and management of special populations, and even just the technology, the lighting, the volume, the tips and tricks. There's so much that is invested in it, and they know that it would be enormously helpful to have the experience from us, because, as I said, we trained over, well, now it's into the 600 students at this point.
That's great.
Dr. Lippman, if I could acknowledge our chair, Dr. Marie Florent-Claret, because she is in charge of rural health and underserved communities. And so within that division is where our telehealth training is housed.
I could see how telemedicine is so valuable, particularly to children and their childhood issues, willing to take the opportunity to involve not only the use of telemedicine, but other, shall we say, new technical venues or areas of information. Even as we're doing this show right now, we're Zooming this show. Who would have ever thought that I'd be sitting in a studio, you'd be sitting in your office, and we could do a show? Well, that didn't happen until this insidious pandemic. We're glad to have you here. You're a very valuable source in the area of telemedicine and pediatrics. I know that, not to get too personal, but I know you've had the opportunity to be the doctor of my grandchildren I'm very pleased and very proud of what our pediatric units do here at the College of Osteopathic Medicine. I do know that HCA has, with their new hospital opening just this week, that they are focusing 1/3 of their entire hospital on children and their NICUs. So it should be very interesting to see how it will reflect upon us, since we are neighbors, we're on the same campus. It should be very interesting to see how influential they are with our focus on children. It should be interesting to see.
It's a gorgeous building.
Sure that knowing them, it will be a perfect venue, and I know they've invested a lot of money in new technologically adroit equipment and things of that nature.
And we do offer telehealth to both children and adults at the NSU clinics.
I know you do. So we have the opportunity to say to the people out there, I always tell them, because this is their show, I take information from them, and they want to know what telehealth is all about, and I hope that we gave them some idea as to what telehealth does and what it can do and how valuable it is. But I always tell the viewers, you got to take good care of yourself, because if you don't tell the doctor what's wrong, then how is the doctor going to know what to do to make you healthy? Well, telehealth is a wonderful opportunity to communicate. So I know many practices are setting aside 1 or 2 days of their work week to telehealth communications. So try it out, take a look, see what you come up with, and know, as I always tell you, you got to take good care of yourself. And the only way you can take good care of yourself is by communicating with your healthcare professional. And if your doctor doesn't know, for example, that you went into a supermarket or a pharmacy and bought things off the shelf, and you don't tell them what you're using, it's very difficult for you. It may mitigate some of your symptomatic problems, but yet the doctor's got to know. So please don't withhold information from your physician. Remember, this show is called Dateline Health. We come to you from Nova Southeastern University. There's an email address and a telephone number right here. If you want to contact us, we'd be glad to forward the information to our guests. And remember, as I said, we come to you from Nova Southeastern University. My name is Fred Lippman. Until next time, see ya.